Edwards, the Cosmetic Services Director here at Surgical and Cosmetic Dermatology. Today I'm here with Dr. David Harvey. Thank you, Dr. Harvey, for taking the time to sit down with me this afternoon.
It's great to be here. Thanks for having me.
Today I'd like to discuss some questions about cosmetic skin resurfacing. Dr. Harvey, I know that you're bringing a new twist on cosmetic dermatology to the Atlanta area. So what is hot, dermatologically speaking, in cosmetic skin resurfacing?
Well, I think the trend these days is to have less downtime. And so the newest trend has been towards a fractional resurfacing, which basically spares a lot of the skin, but you still can target enough of it that you get the cosmetic rejuvenation. So the fractionated approach to laser has really been catching on because of its safety and also its effectiveness.
So exactly what is skin resurfacing?
It's a cosmetic procedure where we use a light or a laser, which is basically a specific wavelength of light to, in this instance, target one of a whole host of things, whether it's water in the skin that can actually tighten. Sometimes we use lasers to target fat. Sometimes we use them to target pigment. So the lasers that we usually are sort of touting now as being the best are the fractionated CO2 laser. So carbon dioxide targets water, and that's how it basically affects the skin. And when it does so, you have a nice, more of a healthy, radiant look, and patients often note that their skin just appears fresher and more alive.
So you kind of described a little bit about how the fractional CO2 laser works. I've heard you before talk about the putting green type analogy. Could you describe that a little?
Yeah, I think that the point is when we're creating the injury to the skin, we're permeating the skin like a golfer wearing cleats on a putting green. So your energy is basically the cleat, and it's the light source that permeates into the green. But if you notice when you step up, you still haven't covered the whole grain. There's still areas that haven't been affected. That's how the laser works. But when it affects that particular aspect of the skin, you can get collagen contraction, which tightens fine lines. You can get improvement in redness, non-specifically that is, and you also can get improvement in brown discoloration. So there's a plethora of effects just from those little sort of injury zones. We call them microthermal injury zones.
This is an example of applied fractional laser technology. Note the white dots of CO2 energy applied to the skin with normal tissue in between. This is similar to a golfer's cleats penetrating a green.
What are we looking at downtime? Is there a lot of downtime involved?
That's another beautiful part about this. I can kind of change the energy settings, and in some instances it can be just a weekend recovery. But if somebody has a lot of deep damage, I can up the ante a little bit, and so maybe the downtime's a week or 10 days. So there's some flexibility. I always talk to patients about the fact that there might be more than one session, in case I don't hit it hard enough or I don't meet their expectations. But usually 1 to 2 is what you would need, and for that reason it is very safe.
This is one of my actual patients. On the left, notable skin discoloration and lines around the lip. On the right, a much more improved appearance with respect to skin texture, color, and elimination of lines.
Well, thank you, Dr. Harvey, for taking time today to answer these questions about CO2 fractional resurfacing. Atlanta, if you have any questions, be sure to post below.